Hello YouTube, I'm Dr. Fox. Today, I'm talking about baby's movements during pregnancy. Understanding your baby's movements becomes vital for assessing their health and well-being. Pregnant women are advised to go with their intuition on this matter, reacting to any concerns, even if they are not completely sure. This is also true during labor and after the delivery itself. Medical professionals should be on hand to examine your baby's movement patterns, and you will be asked to keep a kick count to aid their interpretation. Okay, let me answer some key questions about baby's movements. So, first question would be, how will your baby start moving? Some women feel movement within the womb from between 13 and 16 weeks. There are some challenges at first to tell the difference between movement of the fetus and intestinal gas, but you will soon be able to tell once you are used to the feeling. Some mothers who are pregnant for the first time may not feel anything until the 20th week, but by 24 weeks, almost all mothers will have come to predict their baby's movement. A very small percentage of mothers do not feel their baby's movement. Okay, next, why is understanding movements within the womb important? If there is a health problem with your baby, then their movements can be an important sign, allowing doctors to diagnose what the issue might be. The swifter the response to any problem, the sooner the right treatment can be found. So, understanding your baby's movement is potentially life-saving. Okay, next. How regularly should I feel my baby's movements? Every pregnant mother will have a different experience in this respect. No two babies are the same. The key is to spot challenges in patterns, particularly during the latter months when they are expected to be more active. Keeping a kick record allows you to react to any changes in activity, and mothers are advised to start this earlier if any complications like diabetes or high blood pressure are present. However, on average, it is the case that babies are usually more active in the evening, so mothers are advised to make their counts later in the day. In doing so, lying down makes it easier to feel their movements. If your baby's pattern changes, then contact the healthcare professionals you will be in touch with by now, and certainly do so if they stop completely. With a change in your baby's movements, their heartbeat will be assessed for any issues, and these checks need to be made right away even if it's the middle of the night. If there are any concerns for your baby, your healthcare team will discuss this with you. In some circumstances, you may be advised that it would be safer for your baby to be born as soon as possible. This would depend on your individual situation and how far along you are in pregnancy. Another piece of advice could be, do not use a home Doppler to try to check the baby's heartbeat yourself. A medical professional is essential for monitoring your baby's heartbeat, as such home testing kits are not reliable. Plus, you may not be able to pick up on signs your baby is struggling that a healthcare professional would.